Imagine waking up one morning with a fever so high you can barely stand. Your joints feel like they're on fire. Walking hurts. Even holding a cup of tea feels impossible. Now imagine that pain lasting not just days, but weeks or even months. For millions affected by chikungunya, this isn't imagination, it's reality. In communities already burdened by poverty and weak healthcare systems, this virus doesn't just bring illness, it brings lost livelihoods, suffering, and fear. The mosquito may be tiny, but the impact of the virus it carries is devastating. What is chikungunya virus? Chikungunya virus, ChiKV, is an arthropod-borne virus, arbovirus, that causes chikungunya fever, a mosquito-borne disease characterized by fever, joint pain, rash, and fatigue. Virus family, Togaviridae, genus, alphavirus, genome, single-stranded, positive sense, RNA geographic distribution. First identified in Tanzania, 1952. Endemic in Africa, Asia, and the Indian subcontinent. Major outbreaks in Indian Ocean Islands, 2005 to 2006. India, 2006. Southeast Asia Americas, from 2013 onward. Southern Europe, imported cases. Transmission main vectors. Aedes aegypti, Aedes albopictus, tiger mosquito. These mosquitoes bite during daytime, breed in stagnant water. Other modes, rare. Maternal-fetal transmission, especially during delivery. Blood transfusion, theoretical risk. Symptoms incubation period, 2 to 7 days. Common symptoms, high fever, sudden onset, severe joint pain, polyarthritis or arthralgia. Hallmark symptom, muscle pain, headache, fatigue. Skin rash, often maculopapular. Nausea, vomiting, chronic symptoms. Joint pain can persist for weeks to months, even years in some cases. Complications, rare. Neurological, EEG, meningoencephalitis, Guillain-Barré. Myocarditis, hepatitis, hemorrhagic manifestations, neonatal infections, severe diagnosis. Laboratory tests, RT-PCR, during acute phase. Serology, IgM ELISA, detectable approximately 4 to 5 days after onset. IgG ELISA indicates past infection. Virus isolation, done in research advanced labs. Treatment, no specific antiviral treatment. Supportive care only, rest fluids. Pain relief, paracetamol, acetaminophen. For fever, NSAIDs, e.g. ibuprofen, for joint pain after ruling out dengue. Avoid aspirin due to risk of bleeding. Chronic arthritis may require corticosteroids, disease-modifying anti-rheumatic drugs, DMRDs in severe cases prevention. No licensed vaccine as of now. Some candidates in clinical trials, VLA 1553, MV-CHIK, etc. Vector control, remove mosquito breeding sites, use insect repellents, DEET, picaridin. Wear long-sleeve clothing, use mosquito nets, use screens. Fogging during outbreaks, epidemiology attack rate, high, 30 to 75% of population in outbreak areas. Mortality, low, less than 0.1%, mostly in neonates, elderly, and people with comorbidities. Reinfection, rare. Infection usually provides lifelong immunity. Genetic lineages, there are 3 main CHIKV genotypes. West African, East Central, South African, Asian. A notable mutation, E1 to A226V, in the ECSA lineage increased infectivity in Aedes albopictus, contributing to its global spread. Differentiation from similar illnesses, chikungunya versus dengue versus Zika. Feature chikungunya, dengue, Zika fever, high, mild or absent. Joint pain, severe mild or absent mild rash. Yes, early, yes, later. Yes, bleeding. Rare, common in severe cases. Rare neurological issues. Possible, rare, common, e.g., microcephaly in fetuses. Duration, days to months. Days to weeks. Rapid spread due to adaptability of virus plus global travel. Joint pain is the major distinguishing symptom. No antiviral or vaccine yet. Preventive measures focus on mosquito control. Chikungunya virus. Complete treatment guide. Important note, there is no specific antiviral for chikungunya. Treatment is supportive and symptom-based. Initial assessment, confirmed diagnosis, clinical symptoms, high fever, severe joint pain, rash, travel history, endemic area, lab confirmation if available, RT-PCR first week, IgM, IgG, ELISA after day 5, rule out dengue, especially before giving NSAIDs, malaria, Zika virus, bacterial infections, acute phase treatment, first 7 to 10 days. Fever and pain management medication use notes, paracetamol, acetaminophen, fever and mild pain. First line, safe in all ages, NSAIDs, e.g. ibuprofen, naproxen, joint, muscle pain. Start only after ruling out dengue due to bleeding risk. Avoid aspirin, risk of bleeding plus Ray's syndrome in children. B. Hydration and rest. Encourage plenty of fluids, oral or IV if needed. Advise bed rest to conserve energy. Educate patients about avoiding mosquito bites to prevent further spread. Subacute phase treatment, 2 to 6 weeks. Some patients continue to experience joint pain, swelling muscle weakness, fatigue treatment, symptom treatment. Notes persistent joint pain, continue NSAIDs, ibuprofen, naproxen, anti-inflammatory benefit. Severe pain, short course of corticosteroids, e.g. prednisolone. Use cautiously.